afternoon, respected ma'am. My topic is protein supplementation and diet in pregnancy. Now, why is additional diet required? Why? Because pregnancy is a demanding physiological state. It has been found that in the low socioeconomic state of women, before pregnancy, during pregnancy, after they've delivered the baby, in the lactation period, the diet remains just the same, unfortunately. And this is the leading cause of malnutrition. Malnutrition in turn leads to low birth weight babies, and low birth weight babies we know are more prone for type 2 diabetes and cardiovascular diseases. So, what is the benefit of having a balanced diet? Please look at the pregnant woman as a whole. Think of the physiological and emotional and physical stress she has to go through during those 9 months. Before she plans a baby, if she's from a low socioeconomic strata, just happens. But during the 9 months, post-delivery, taking care of a baby, taking care of her home, and majority of the girls who are coming to us are working. So managing their work front also. So how this balanced diet helps her to cope up with all these extra stress. So besides helping the mother, a balanced diet will also help the baby having good birth weight, cognitive development, and of course a future healthy life. We've already talked about the energy-rich foods, bodybuilding foods, and protective foods. What are the key ingredients of the diet in a pregnant woman? Folic acid, we all know, iron, calcium, protein, omega-3 fatty acids, vitamin A, C, D, and other micronutrients. Let's focus on proteins. What is the role of protein during pregnancy? Not only for the pregnant lady, but also for the growing baby. It is needed for the growth and repair of the damaged tissues, helps to make hormones, enzymes, antibodies for the immune system, transporting oxygen, and also supporting the muscle function. For the mother, besides effect on the fetus, the growing baby, also needed for the maternal tissue repair, for the placental development, and also for the blood volume expansion. And of course, like I just mentioned, a patient who is malnourished during pregnancy has a baby with low birth weight, and this in turn increases the risk of type 2 DM and heart diseases. For the pregnant women, the incidence of preeclampsia, premature birth, they all are increased in a protein deficient diet. Now this is something, a little busy slide, but I find it very interesting. At a molecular level, what is the effect of low protein and low amino acids? So I came across one interesting fact. One is a histotropic nutrition, another is a hemopoietic nutrition. Histotropic nutrition is the growing embryo. How does it get the nutrition it wants? It gets it from the lining of the fallopian tubes and the uterus. So it just absorbs. It is at this point of time that proteins play an important role, because eventually once the placenta forms, it is a hemopoietic nutrition, because there is exchange of fluids between the mother and the growing fetus. So it is the histotroph nutrition which gets impaired if there is low protein and amino acids. There is impaired mTOR signaling. Now what is mTOR cell signaling? It is a balance between cell proliferation and cell death. So when this happens, the placental formation is impaired. There is reduced angiogenesis, reduced supply of nutrients, oxidative stress both in the mother as well as the fetus. Then all in all, it actually leads to fetal death, early embryonic death, loss of pregnancy, IUGR, and poor maternal health. Which is the trimester in which proteins are most important, the second and the third. And in a roundabout way, what is the amount of protein needed? In the first trimester, 1 gram, increases to 1.5 in the second, and 2 in the third trimester. Now, my focus on this was because we have majority of pregnant girls coming to us who are vegetarian. It is so easy for us to tell if a non-vegetarian diet, fish, egg, and chicken. But what do you tell a girl who's a Jain girl? We'll call you, ma'am, uspe red nishan hai, uspe hara nishan hai. So I used to be so puzzled, and actually took time to go through and find out what I can offer her best, besides my dietitian friends. So I found this list of foods which are rich in protein. All the dals, green peas, chana, soya milk, rajma, broccoli and spinach, chia seeds, nut seeds, paneer, and pumpkin seeds. Correct me if I'm wrong, Dr. Deepika. Which veg food is richest in protein? Green peas. Which dal is high in proteins? Moong dal. And which Indian vegetable is high? Again, green peas, of course, Safed chana is also very good besides tofu, but we are Indians, we don't like tofu, at least I don't. I would rather prefer paneer. Now, does paneer...
Your personal choice doesn't come here.
Does paneer have protein? Yes, 14 grams. Does dahi has protein? Yes, about 11 grams. Now coming to omega-3 fatty acids. We all know that these are polyunsaturated fats. Anyone who would know difference between saturated and polyunsaturated? So polyunsaturated fats are healthier than the saturated fats. They are essential because essential means you need to consume them through the diet. We are aware of the three main types, EPA, ALA and DHA. Now, they are good for several reasons. We all know about the decreased risk of cardiovascular disease by reducing the inflammation, lowering the triglyceride levels, and preventing the formation of blood clots. DHA, we all know, so many combinations coming up with DHA. It is a major structural component of the brain and important for the brain development and function. Also, associated with lower risk of cognitive decline, improved memory, reduced risk of mental disorders as depression, anxiety. It is also found in the retina of the eye and so reduces the risk of age-related macular degeneration. So besides the help in the adult, whether male or female, also in the baby, the eye development and the brain and nervous system development. That is why it is recommended from the second, third trimester and also postpartum. So the daily dose advises 200 to 300 milligrams per day. We know there are three main types. EPA, it is a marine omega-3 found in fish. DHA is also marine omega found in 3. So what do the vegetarians do? The only omega-3 fatty acid left is ALA. Now, God has been kind. Some amount of ALA is naturally converted into EPA and DHA. Again, my focus was on vegetarian sources. So, what are the vegan and vegetarian sources of omega-3? Flaxseed oil, chia seeds, walnuts, and of course flax seeds themselves. Which fruits have majority of omega-3? Kiwi, papaya, avocados, berries, and oranges. Folic acid we all know, iron we all know, calcium we all know. Hydration we all solved the quiz, so we know that she needs to consume at least 2.5 liters of fluid in various forms. Caffeine intake. Now why is water needed? Again, this is not we're telling her to increase her fluid intake. It is needed for increase. Now the blood volume we know increases from 5 to 6.5. To support this increased blood volume, thank you so much. And also to maintain the amniotic fluid and providing nutrients to the baby. Most importantly, pregnancy is prone to constipation. So that is also where women are advised to increase their fluid intake. Caffeine we know the safe is 200 grams per day. Now just a short word about the weight gain. It depends upon the initial weight of the patient. If she's underweight, the recommended weight gain is approximately 12 to 16 to 18 kgs. A normal BMI, which is from 18 to 25, it is again from 12 to 15 kgs. And overweight, she needs to just put on about 8 kgs, and obese, 5 kgs is recommended. As far as the calorie intake is concerned, first trimester 0 or nothing because she's busy vomiting and having food cravings and food aversions. Second and third trimester, the calorie intake is advised from 2200 to approximately 3000 calories. While we are advising the diet to the patient, please keep in mind that some things are very much normal and physiological. The nausea, vomiting, the aversions, the cravings, we have to deal with them. Then she might be diabetic, she may have iron deficiency anemia, she may be having constipation. We have to deal with that again and reduce protein intake. We have to advise the diet rich in protein. So it has to be customized. So the importance of prenatal macro and micronutrients. To fill the nutrient gaps, address the dietary restriction, personal or familial. The early pregnancy planning is the part when you can advise her to take requisite amount of micronutrients and vitamins and folic acid. Then to prevent deficiencies, support the maternal well-being and long-term health consequences. This I just found interesting, so I added it. What are the 10 foods you need to avoid while she's pregnant? We all know about raw papaya, and you get a call whether I can take the Tastemaker, one of the most popular brands of noodles. So the answer is no, of course. And restricted amount of alcohol and tobacco. Caffeine, we know how much to take. And street food is actually written as 10 foods to be avoided because we know it is all the bacterial contamination and hepatitis and typhoid and gastroenteritis. Why burden her with unnecessary medication? Proteins are also needed during lactation. for adequate supply of breast milk to build the tissues, muscles, and promote weight gain for the baby, support growth and maintenance of the infant. That's a smiling face, ma'am. And help synthesize hormones, enzymes, and antibodies for the growing fetus. So to conclude, why we advise the patient to have extra protein and have a balanced diet is for the fetal development, prevention of complications, for healthy weight gain, reduce the risk of preterm birth, for the cognitive development of the baby, postpartum recovery, and of course long-term health impact both mother and the baby. Thank you.